One of the major problems in that area, in the community where there's a lot of people and there's poor, their poverty is infection of the chest. Okay, in Philippines, a lot of people are still dying of tuberculosis. And I think it's very common among countries that are very poor. And I will not be surprised if Myanmar also has so many tuberculosis cases. But this is a problem that can be prevented. And I do not want you to catch this disease. Because if you are supposed to go to America or Australia and suddenly you have the tuberculosis, you cannot go until you are treated. Just imagine you waited 6 years, 7 years. And then you already have the ticket. You already know where to go. And then suddenly you go to the hospital and you had an X-ray and you had tuberculosis. And said, sorry, you cannot go. So hard, right? Yeah. So anyone has done X-ray? Chest X-ray? Oh, very good. So, clear? No problem? Very good. Continue to do that. So, let's find out what causes this disease. What do you think causes this disease? Huh? It's a bacteria? Yes, very good. It's called Mycobacterium tuberculosis. Yes, it's a bacteria. And every one of us has that bacteria inside us. Inside you. So why if it's inside me, why am I not getting sick? Why do you think? We have good health, very good. So when you have good health, the bacteria is sleeping. So don't wake the bacteria up, okay? Yeah, let the bacteria sleep. But you know, in Philippines, normally the bacteria is inside the human beings. But recently, according to research, in Philippines is now on the soil. Why do you think it's now on the soil? Because so many people in Philippines, 100 million. 100 million. And then, just imagine all these 100 million when they cough and they spit out. And they spit everywhere. Now, if you have the habit of spitting, and you go to America, you're going to be caught by the police. So better practice, don't spit on the road. Because they're very strict with that, you know. Okay, so what if you're really coughing and you really want to spit? What do you do? What do you do? Swallow. Yeah, at least it's going inside your stomach and it's coming out. That is true. Then you're not affecting anybody. The other one is to carry a tissue paper. So you will spit on the tissue and you throw it in the garbage. Okay, so we know that what causes this disease is because of bacteria that is active inside us. These are very But they can be passed on from one person to another. How? Sneezing. You know the bacteria can jump 2 feet. You know. Yes, yes. It's like this. Achoo. 2 feet. Okay. So, and then, so it can jump from one person to another. The other one is if you use your hand to cover your mouth. And then you cough. And then you say happy Sabbath. Oh, so where did the bacteria go now? That's why I do not want to shake hands. Because it is inside your head. So the head is the carrier of the bacteria. Okay, so it can pass on by jumping or by a person passing it to another person. Where else? Okay, where else? This is called indirect transfer. This is direct. There's an indirect transfer. Say for example, you come to the church, you did not talk to anybody. You come to church, you did not talk to anybody. So the bacteria did not come out from you. And then you did not shake hands with anybody. So the bacteria did not come out from you. And where else can you get it? Exactly. When you use, and it was not a spoon, fork, glass, plates that are not washed properly, and you use it. Yes, wash the hands all the time. Or I always carry with me alcohol. After I shake hands, Zomi, I have to wash my hands with alcohol. And I tell you, it's not because I'm being so, I'm not friendly or what, but I'm protecting myself and I'm protecting other people also. You see? So, this one is very common in Philippines. Here you can get it from Guardian, but it's about 2 ringgit, I think. If not mistaken. The small one. So I always carry this in my bag because not all the time there's a hand washing area. Okay, so when you go, so what's going to happen inside your bag, especially what's inside your bag, especially for ladies, tissue and hand sanitizer. Oh, especially if you go to the first world countries, you need those. So how do we know if you have the infection? You cough? What do you do if you cough? You take cough mixture. Cough mixture. Medicine. Yes? But don't you know that coughing is actually cleaning your lungs? So sometimes by taking medication, you're stopping the cleaning process. So if it's like 7 days, 3 days, 7 days cough, don't worry too much about it. Just cover yourself and avoid crowded places. Try to clean up your chest. But when will you know that it's really an infection? What happens? What do you get? Long time coughs. That means how many weeks? 3 to 4 weeks of coughing. When you cough for 3 to 4 weeks, that means you must go and see the doctor already. Okay, what else? If there is fever and chills. If you're coughing and then you're having fever and you're having chills, that means go and see the doctor. But if you're just coughing and without any fever or chills and few days only, no need to take medication. So when you go to the doctor, they will do X-ray. Okay? And then they will check your sputum. Anyone has done this X-ray? Okay. What about sputum? Also, okay. Are you going already to the check? But it's requirement, is it? It's a requirement, right? It's a requirement for you all, or you just go by yourself?
Work requirement.
Why did you? Work requirement, yes. Okay. Yeah, so 2 days they will do X-ray and then sputum exam. And they will know what's inside your chest, whether there's a They will know whether there's a big monster or little monster. Or no monster at all. If no monster, good. Okay. Now, there are 2 types of chest infection. One is pneumonia, the other one is tuberculosis. Pneumonia is caused by a virus, while tuberculosis is caused by a bacteria. There are 2 groups of people who are very prone to pneumonia. Very old, 70 and above, and children. Okay, 5 years old and below. They're very prone to pneumonia. Okay, now normally people with pneumonia will cough a lot, will have high fever, feel weak, and no desire to eat at all. And normally the children will have really high fever and chills. So what do you do if you have all these symptoms? You go to the hospital immediately because you need to be treated with antibiotics. Okay? Because if not treated, patient normally will die. It's very serious. Okay? Now the other one is tuberculosis. Now tuberculosis is contagious. Contagious, meaning you can pass it on. Okay? That's why just now earlier I was talking about how the bacteria is passed on. That's how you can get tuberculosis. Especially if you're living in a crowded area. For example, one room, how many of you stay? How many? 10? Not 10 ah? 5? Right? Yes. 7? That's a lot of people inside one room. So what do you do if one is coughing? Nothing. You don't do anything. Let the person sleep far away from the crowd. If not, the Romans have to sleep in the toilet. Joke on me. But do you know what I mean? It has to be away from the crowd. Because as I said, the bacteria can jump, can walk, can crawl. Okay, and Ellen White said, open the door. Window. But then you open the window, all the carbon monoxide come in. No good. If not carbon monoxide, dengue or mosquito. Then you don't get tuberculosis, you get malaria or dengue. Either way bad, huh? Okay, but let's talk about TB. So it's passed on from person to person. We already say hand washing is a must. And have the person who has it with different plate, spoon, fork, and glass. Now, if tuberculosis can be prevented, why is it that so many people die from this? Because they wait too long before they go to the hospital. How many weeks before you go and see the doctor? Yes, 3 weeks at least. 3 weeks coughing. And then you lose appetite, don't want to eat. And then you are thinning, you are losing weight. And then you have fever. Coughing for 3 weeks, go and see the doctor. Okay. The other reason is because you stop taking the medication. You know how many months before the TB is cleared? 6 months. Yes. So for 6 months, you have to take the medication regularly, like a prayer, That's why if you already accepted to go to America and you have TB, you cannot go for at least 6 months. So that's why it's better to avoid it. Okay, so we talk about it. These are the signs of tuberculosis, yeah? Weight loss, you feel tired. Sweating at night. And chest pain when you cough, especially. Alright? Now, if there's severe tuberculosis, when you cough, there's blood coming out. And very pale. Because of all the blood coming out. Then you got no more blood. Okay? So must see a doctor immediately. Children is the same. There's weight loss, fever for a long time, and there's swelling here on the neck. Somewhere here. So mothers, you can feel the lump if the baby is having fever or coughing. You can feel the lump here. If you can feel that there's swelling, that means that it may be positive TB. Okay, and pale skin also. So go to the doctor immediately. They will do sputum exam and chest X-ray as well. Okay, so what else can we do to prevent TB? Okay, number 1 is hygiene. Okay, as I said, when you are coughing or sneezing or you're not feeling well, better not come to church. Yeah. You don't want to transfer it to people, especially the children and the very old. Okay? Even though you really want to, hear the music and hear the sermon. But other people are more important as well. Okay? Avoid crowded places. Always carry with you a handkerchief so that when you sneeze or you cough, you cover it. And if you decide to come to church, you can sit far, far away and don't happy Sabbath, everyone. They will understand. Hopefully, they will understand. We're so used to shaking hands. We should practice this happy Sabbath. Or happy Sabbath. I like this better. Or you say happy Sabbath. We should change our culture, really. So next time you see me, just say happy Sabbath. Yeah. So hygiene is very important. Always hand washing. Okay. And the children, especially little children. Okay. Make sure that they are clean. Okay. Wear slippers. Okay. And then the dogs and the cats, don't let them roam around the house. Because remember, all these viruses and bacteria can pass on from one person to another. And then when you cook, those mothers who are cooking, make sure the vegetables are washed properly. Wash your hands before cooking. And prepare the meal as hygienically as possible. The other one is immune system. Do you know what is immune system? What is immune system? What are these? These are your soldiers. These are your soldiers inside your body. These are the good cells that fight all the enemies that come in. And in order for you to be healthy, your immune system must be healthy also. All the soldier cells must be very healthy. So how will you be able to keep yourselves healthy? Healthy food? Very good. What is healthy food? Nasi lemak, nasi lemak. Nasi what? Healthy food. What is healthy food? KFC, good food. Nice. Good fruits. I thought good food. When you say good food, Mr. Away. Good fruits, okay. Is there any bad fruits? Why you say good fruit, huh? Yeah, the ones that you don't like is bad fruit. For example, if I don't like durian, then it's a bad fruit. No, all fruits are good, okay? Whether you like it or not, all fruits are good. Okay, so you're saying bad food. What are bad foods that kill your immune system? What are the killer foods? Foods that kill your cells. Maybe. You're not so used to this. Sure. Huh? Very sour fruit? No. Huh? Pepper? Apples is a good fruit. Okay, the question is this, what are examples of food that kill your good cells? Food. Not fruit. No, food. Oh, that's what I said. Food, I follow you. Deep fried foods, very good. Oh. Barbecue. Okay. Yeah, what else? Huh? Belacan. Belacan? What is belacan? Myanmar belacan. Fish paste or fish paste? It's still fish. You say deep fried food. Yes, deep fried fish, deep fried potatoes, deep fried chicken, deep fried beef. Huh? Salty, yes, high salt food. Okay, what else? The killer of them all are the sweet foods. Sweets. The sweets are the killer foods that kill your healthy cells. What sweets do you normally eat? Candies for children, yes. So not much sweets for you also. Lollipops, soft drinks. What else? Ice cream, yes. What else? Chocolates. No, I'm not saying that. Don't eat to it. Then you will be like, can I eat all these things? So sad. But if you eat it every day, chances are you are going to catch cold. Especially the children. Okay, so Rose is going to talk more about food later. Okay, so what else are the killer of immune system? Cigarette smoking. Cigarette smoking. Then you say, oh, I don't smoke, so I'm okay. Yes, sir. If you don't smoke, you're okay. 50% yes. Why did you say 50% yes? Why did you say 50% yes? Because? Oh, very good. Oh, yes. Second-hand smoker actually are worse according to research. So if you are not smoking, but your friend who's next to you smoking, you are inhaling what's already inside his lungs. Yes, so you are getting double dose of poison. So it's worse than smoking. Yes. So avoid people who smoke. Not because you don't want to friend them, but because you don't want to get sick. Okay, so what else? Alcohol? Well, you don't drink, right? I hope not. But if you're drinking, stop drinking now because because it's not good for your health. Of course, eat healthy food, a lot of vegetables, a lot of fruits. Rose is going to talk about it later. Okay, let's talk about fresh air. Where do you get fresh air? In the park? Why in the park? What if the park has no tree? Huh? What if there's no park? In the city, yes, correct. Early morning is when there's a fresh supply of oxygen because the plants are sleeping at night and in the morning they wake up and they come up with so much oxygen. They're very good, especially 4, 5 a.m., 6 a.m. So early morning, oxygen is really good. So go nearby a tree and then take a deep breath 5 times. Yes. Especially you are in the city, this is very far from where you come from. You remember where you come from? No problem with fresh air? Do you miss home? Let's go home. Yeah. Myanmar is good now, you know. Okay, never mind. So yeah, those kind of places with a lot of trees, a lot of green, that's where you can find a lot of oxygen. And then sunshine. Do you need sunshine? Why? Kill the bacteria, that's true. But what else? Very important. Yes, because you cannot process your vitamin D inside your body without the aid of sunlight. Okay. So what time do you need to go out to get the sun? 9 o'clock? Huh? Early morning? Early morning ka sun, man? Okay. How many say 9 o'clock? 9 o'clock. Okay. I'm talking about the best sunlight, huh? 9 o'clock? No? Okay. Before 10? Who said before 10? Okay. What else? Sunrise? Okay. No. Before 8? Okay. All your answers are wrong. Okay. We're talking about recent research, okay? According to latest research, is the time between 11 a.m. to 2 p.m. That's when the sun is so hot. And you don't need to be out there for 2 hours. Okay, this is the requirement, yeah? Dark-skinned people. We're talking about Indians, Africans. 20 to 30 minutes. Okay. Fair-skinned people. How about like us? 15 to 20 minutes between. And white people. About 10 minutes at most. Between 11 a.m. to 2 p.m. And we're talking about no umbrella, no hat, and then as exposed much skin as possible. But you don't have to take out your clothes. Okay, but that is the best time to get your vitamin D. And latest research is showing that vitamin D has so much, it prevents a lot of diseases, including cancer. So you don't need to go out too long. 15 minutes, it's okay. And of course, drink a lot of water. And we're talking about sky juice, okay? Is Milo water or not? What about juice? Orange juice. Water or not? So what do we mean by water? Colorless? Odorless? What else? Clear, huh? Clear water. Okay, so at least 8 glasses every day. And of course, resting. Take a lot of rest. Especially if you are not feeling well. And always wash your hands. God wants us to be happy and healthy. Disease is never in God's agenda. He wants you to have a long life so that you can praise Him and so that you can serve Him. And He says, happy is he who has the God of Jacob for himself, whose hope is in the Lord his God. Any questions? You understand? Okay, so I wish you all well. If you have any questions, translate immune system. You can translate. Wow, you're good. Okay, thank you very much for listening.